Mic test, mic test, test.
Going to get going. Derek, are we good? Everything in the booth? I know we had a convention going on in there earlier today. We good? All right. Anytime there's that many people in the control booth, you get nervous, right? I'm told that we have some new technology today. And so we're on day one, cold start. So this is kind of like the first day of Epic. You know, it was like everybody's kind of hold their breath to make sure it worked, but we are going live today and hopefully it all works out good. I can certainly hear us better. The microphone is definitely working. So I'm informed of no citizens wishing to address the Finance Planning Committee today. So I will move on to our approval of minutes. Hopefully you've had a chance to review those. And if you have, I'd like to entertain a motion and a second to get those adopted. A motion from Reverend Emerson. Second, Doctor. Okay, we have any question or discussion? If all in favor, say aye. Aye. All opposed, same sign. That motion carries. And now that will move us to our reports and updates not requiring committee action. First is our master facility plan. Jill, Ramon et al., welcome. Good to see you today. Tell us how we're doing.
Good morning. Have Glenn here. If y'all recall, he's our new program manager with Broadus Levis, and so he'll be providing the update, and Ramon and I will fill in any gaps where needed.
Good morning. My name is Glenn Deaver. I'm the program manager for Broadus Levis. I'd like to thank you for the opportunity to provide an update. And regarding the JPS Master Facility Plan program. Overall, the program is moving forward. There's progress on each project, including positive engagement by GPS and their contracting partners in planning, design, and active construction. As noted in previous meetings, the temporary parking project is complete, and 3 other projects are in construction, one of which is also nearing completion. All current projects that are under construction will be completed within the next 13 months. I will address these projects, the Medical Home Southwest, the Psychiatric Emergency Center, and the new parking garage in more detail via the presented dashboards. There are also 3 projects in pre-construction design phase, the MOB, the hospital, and the CUP. These projects continue to move forward according to schedule and as anticipated. So if we can go to the next slide. The medical outpatient building, or excuse me.
You see?
Which one are you doing?
I'll do Medical Home Southwest. Our medical outpatient building. Let's see, which slide are we at? Medical Home Southwest. I'm sorry.
I
got my-
Is that where we are?
Yep, that's where we're at. Medical Home Southwest. The Medical Home Southwest project is approaching project completion. The go-live date was actually this past Monday, February 24th. Currently, the project has some minor furniture and equipment being installed, and it'll be completed this month.
But we're meeting our operating intent.
Yeah, so we opened on Monday with the exception of the pharmacy. We're still, remaining some casework and things like that from the pharmacy to be operational. That should be later in March, but yes, we had 100+ patients scheduled for Monday, day 1, to include primary care, optometry, as well as behavioral health. So we opened on Monday successfully.
Great, good news. Congratulations.
It's a great partnership
Great
with
news.
JPS and the builder and our team. So it's very good work. The next project is the Psychiatric Emergency Center.
And that's one slide earlier in your deck, everybody. So that'll be slide 7. I'm sorry.
That project continues to see positive progress as it moves toward completion this summer. The team has recently worked to coordinate critical shutdowns related to connecting the PEC to the existing building service utilities. The team continues to work effectively and continue to meet established budget and schedule. And that shutdown was very complicated, and the team worked and collaborated tremendously.
We also hosted a group from near South Side this past week as well to tour that facility. So we had stakeholders from this community, from all types of businesses tour that. They were very excited to learn about all the services that we were going to provide. So it was a very positive tour with the community that we're serving.
That's great. This is a highly anticipated project. Everybody that goes through it is like, wow, that's going to be a game changer for JPS. So congratulations. Awesome.
Okay, and the next slide, new parking garage. The new parking garage project continues to successfully move forward and continues to remain on schedule and on budget. There are no real current issues associated with the garage project. Design efforts associated with the Women's Health Clinic, which will be located within the new garage, continue to move forward. Current efforts include establishing and finalizing new programmatic requirements. The project schedule and budget for this work are being evaluated and updated. This information should be available within the next 30 days. The garage is scheduled to open in late spring of 2026.
So is the current plan that we open women's health simultaneous to the garage?
Yes,
All of it opens at the same time?
yes.
Great. Any questions on the parking garage? All right, Glenn, thank you, sir.
All right.
All right.
Thank you.
Thank you.
Good news, moving forward. So let's move to our matters requiring committee action. Our CFO, Courtney, welcome.
Courtney, come on up.
Rory is out today and I know, appreciate everybody's prayers, so for he and his family, but Courtney, we're glad to have you here.
Thank
We
you.
promise to make this really painless.
Yeah. Courtney, do you want to go ahead and introduce yourself? Courtney, I believe, has been here at JPS off and on for about 5 years. Is that
Yes,
correct?
close
Okay.
to 5 years at JPS, and I've have about 20 years of healthcare accounting experience at Cook Children's, and then also at Texas Healthcare Physician Group, and then here at JPS.
So what is your official title, Courtney?
I'm the controller.
Fantastic. So
Yeah.
you're the person that should be able to answer all these questions anyway.
I hope I have all the answers. Just make them known. No, but
We're
good
glad to
morning.
have you here, Courtney. Thanks for
Thank
being here.
you. I do appreciate you allowing me to fill in for Rory. I appreciate the opportunity and to be able to help him out in this way. I'll start with the CFO update. There's a few items. The first is that we had 4 of the bond rating interviews that concluded, and we have received 3 of the 4 reports so far. The 4th one is outstanding and is due. We should expect it in a couple weeks. And I'm happy to share that the 3 reports that we have received, we've maintained our bond rating from last year. That's very good news. The second item is, it's that time of year again, it's budget season. So FY26 budgets are in full swing underway, so more will come to you in the coming months regarding that. The third thing is the Hilltop Quarterly Investment Report was placed on your board portal this morning for your review.
Yep, I got that. So thanks for providing that for us.
Okay,
All righty.
and I will move on to the financial report for January. As always, included in your packet is the executive summary for your review. On the income statement for January, I'll go over some of the monthly results as well as a little bit on the year to date. For the month of January, we had strong volumes and favorability in expenses. So we ended up with an operating loss of 26.5 million compared to a budget of 39 million. So favorable about 13 million. If you drop down to include non-operating revenues and expenses, net income generated 25 million compared to a budget of 11 million. So about 14 million favorable. So there's a few items that contribute to that. Starting up in the operating revenues and net patient service revenue, we had high volumes across the board, except for a slight decrease in some clinic volumes on the outpatient side due to a couple ICE days that we had in January. But we did, however, still end the month positive of 2.5 million for net patient service revenue. Retail pharmacy continues to outperform budget. We're favorable 1.6 million for the month. That is largely due to the specialty pharmacy where we are having improved capture rates in specialty drugs. And then just overall volume increases across the other retail pharmacies. On the expenses, we are favorable 8 million for the month. You can see the majority of that is up in the salaries line item. For the month of January, we have timing related to market adjustments. And then we had the lower staffing for a couple days due to the ICE. And we have continued work around overtime and premium pay to reduce those, and that work is paying off. We're seeing favorability there. Moving on to the year-to-date, we have had a very strong first 4 months of the fiscal year. We are at an operating loss for the year at 111 million compared to 143 million budget, so 32 million favorable. And then net income is generating about 33 million more than budget. So a few items to note there is supplemental Medicaid funding. We received 5.5 million in a DSH redistribution payment for a prior year that was received last month. So that is causing favorability there. In retail pharmacy, like I said before, specialty pharmacy continues to have big volumes for the capture improvement. And then on the expense side, salaries are 8 million under budget. Again, that's timing of market adjustments and the work around overtime and premium pay. And then other expenses in various categories are just really due to timing of key projects for the year. And I do expect those expenses to continue to catch up as we progress. In non-operating revenue, if you recall in December, we sold some land in Jessica that generated us about $5 million gain on that sale. So you'll see that there in the other non-operating revenue. So those are really the key points for January and fiscal year to date on the income statement. Are there any questions?
Questions for Courtney? Yes, sir, River.
Ad valorem tax revenues. So we're doing a little better than what we projected then.
That is related to a TIF refund that we received in January from the downtown Fort Worth TIF. So that's a kind of a one-time pickup there. Okay.
Other questions for Courtney on the income
Was
statement?
that TIF budgeted?
Yes. It was budgeted, but it was a refund because they hit their max of TIF receipts.
Yeah, that's one of those older
Yeah.
reinvestment zones that's beginning to come to its end. So that may not be the last reimbursement that we see from that one.
So the additional income, apparently the new pharmaceutical business that we did, we had extraordinary land sale, but had a little less overhead than we anticipated.
Than some of the supplemental.
So
The dish. Mhm.
Yeah, had we
That was back in
anticipated that,
2018 That they've actually balanced us.
I was gonna say that this trip is
From
old stuff.
2018,
Wow.
yeah, so
Mhm.
we would not have seen it at the time,
So
seen
look-
this coming at the time we made the budget,
kind of looks like we're trending year over year about dollar for dollar.
similar to last year.
I mean, do you anticipate as the budget rolls out for that to continue, these stronger revenues and less overhead?
I would anticipate the revenues to stay strong. I mean, that's kind of the trend that we've seen. As far as expenses, I would anticipate that we will start catching up on some of those expenses and kind of close that gap a little bit as we progress through the year.
Thank you.
Okay. Next, we'll look at the balance sheet. We do have a very strong balance sheet. There's really one thing I would point out to you on here, and it is the board restricted funds for the master facility plan. That is the future fund. And you can see that increase from the prior year to the current year. So we're sitting at $1.1 billion. That is a reflection of the transfer from operating cash to the future fund that you all approved in December. So that was transferred over. Any other questions on the balance sheet? Right, on performance ratios, this report we do provide to you every month for review. There's really no significant changes that occurred in January to point out. So we'll go to the next slide, which is the statistical highlights. I think the theme here is that volumes continue to be high for the month and year to date. Also, this compares to prior year and we're favorable to the prior year as well. So it's been a very busy 4 months at the hospital. The next several slides are just kind of graphical presentations of some of the stats that were on the previous page. So we'll just highlight a few of them. On the inpatient stats, admissions continue to be strong and outperforming budget. That is for the month and year to date. Next, in outpatient stats, emergency department visits are strong every month, inpatient and outpatient. Primary care visits and specialty clinic visits, you will see a little small decline there in January. Again, that's due to the couple ICE days that we had. However, year to date, we are above budget. On the surgery statistics, inpatient and outpatient volumes are strong compared to budget. Those higher admissions that we're seeing in the hospital, of course, are translating into higher inpatient surgeries for the year.
Yeah, we're outperforming on inpatient significantly over budget. Is there a reason for that? Yeah, I mean, it's just an unanticipated volume that we didn't budget for.
I think we've done a lot of work from an optimization standpoint in the operating room, led by, Dr. Assad, leading that work. And so we are ensuring we are capturing every single space in the operating room. In addition to having the higher inpatient volumes, you also have higher
Sure.
surgeries to go along with that.
So Jill, is it to the point that we would be able to adjust our budget anticipated surgeries for next year based on?
Oh, absolutely.
increased levels?
Absolutely. We would not go down. Absolutely. As we continue to further optimize, there's opportunities still at Jessica for additional OR space as well. So we would not go backwards for FY '26.
Use the last 6 months, so it's probably going to look.
Yeah, it's gonna
really
be a pretty
strong
big
on
difference,
that.
isn't it? Because that's a major
And then the
difference.
throughput work continues to go on, and so we're really able to turn over those beds.
It's great. Well, congratulations, because the utilization of the rooms has been a challenge, and being able to utilize those things on a more efficient basis is obviously producing some pretty significant increases for us. So that's great news.
How about the medical home? How does that project higher need for
Are you-
services here?
You're talking about medical homes, the new medical
That's
home?
correct. I'm just wondering how that ties into this.
So that was considered last year that we would open it. We actually thought we were going to open a little bit earlier, but that we would open that, and so that those volumes were
I
put
see.
into that. Now, remember, Medical Home Southwest was really a transfer of the South Campus Clinic to the
I got
medical
you.
home. So we pretty much took that volume, and the additional volume that we'll see at Medical Home Southwest is due to the growth in behavioral health at that site.
Gotcha.
So those are new FTEs that we had to hire for that additional volume we would see in behavioral health.
Dr. Duncan, it'll be real interesting over the next couple of years to report back on the results of providing that expanded behavioral health service at Southwest, because it can be a template that helps us understand what to expect with the other clinics, because this is going to be such a pristine operation in terms of its capacity that, this might be something we can look at for the future for others. So if we could get, maybe just have Zelia every now and then come up and give us an update on how that's doing, because it should be amazing.
I agree.
Mhm. I know that Rory has been looking into that, so once he returns, I can get with him and we can get back with you. Okay. Yeah, I know that he's done some work on that. I just don't have that information with me today.
Come back and take a look at that.
I think we need to look at documentation too, how
Yeah,
good we're
coding
doing
and
on that, especially as
documentation.
we have residents and training, so.
Mhm. All right, any other questions for Courtney on the inpatient statistics or outpatient or surgery and behavioral?
Okay.
So Courtney, anything on the financial metrics that you need to highlight for us?
I would just highlight there that payer mix that, let me get there. Payer mix in the top left-hand chart. We do see a decrease in commercial payer mix and an increase in connection. So that's always something that we watch and keep an eye on. And then in the connection connection enrollment chart down there in the right-hand bottom corner, just wanted to point out, you do see that strong continued growth for the last 9 months.
Sure, just about that. The self-pay also looks like it's gone up by about the same percentage that commercial has gone down. Did a plan close or did a plan down patients at the start of the year to self-pay or?
We had Cigna Marketplace, which was a commercial plan. And last year they had, we were the only hospital in network in the area. In 25, they have expanded that network. So we may have lost some patients there. There's another plan, WellPoint, that came into the market. So, we're monitoring to see if that volume shifts.
Trying to rev up on them.
But there's
Well,
no
point.
Obvious external factor we can identify for specific to January that self-pay went up that much. I mean, because it looks like it's
No.
been relatively constant, 13-14%, and now creeping up with changes at the start of the year. Is this something we're going to expect to continue, that they're not going to qualify for either one of the marketplace plans or connection?
We will look into that and bring something back next month or get back with you before then.
I mean, good question. I mean, we don't know what's going to go on with Medicaid. Medicaid has not done well with unraveling. Even last year, now with the threat around Medicaid, we might start to see those who can't qualify for JPS connection, to your point, really fall into self-pay. But we think a lot of this is really the loss of the Cigna.
Mhm. Not that I've been made aware of. I would have to ask Rory about that, the contracting piece. That's the revenue cycle's his wheelhouse.
Well, came in more favorable to the patient than
Yeah.
the
Mhm.
Yeah.
which means we're hoping the market share will grow.
Yeah, exactly.
Yeah.
Seal your mouth.
Good question.
Once we have the program. So each month now have to give it our connection, not that everybody comes to the line.
That's great.
That every month.
That's great.
Not like they're doing today.
Yeah,
That's great.
yeah.
And the other program you may recall has been the Sound Care, in which we work with Visit Fort Worth with the musicians to create a JPS connection light program, which is called Sound Care. So I think, getting the word out has really helped in growing that JPS connection number. So truly appreciate that work that you're doing.
Yeah, that connection enrollment number has always been a little enigmatic because we look at it only relative to what happened the last year and last month. And one, just so Rory knows we love him when we miss him, when he comes back, I want to put an item on the finance agenda to talk about what we look at in terms of cross-reference data to tell us what that connection potential is in Tarrant County versus what our connection actual is. And there are several things that can be done to look at that, to reference it. But the idea is not so much as is it growing or not growing,
Mhm.
but how are we doing relative to the connection potential, the connection need in Tarrant County? Because we've never really done much cross-referencing at the board level on
Mhm.
what that looks like, but understanding Because our connection population continues to grow, and that's good. I mean, it means we're more efficient. It means we're getting information out there. We're getting people, re-signed up. But what it doesn't necessarily tell us is how we're tracking connection relative to the overall need.
Right.
The last time we looked at it was when we were building the strategy around the master facility plan. It was about 100,000 are out there. So we're probably getting about half of it.
30,000 short of where it
Yes.
should be. And we'll never, it's not necessarily a function of performance. I'm not implying that it is. It's more an understanding of the relative demand versus what our capacity is.
Yep, that makes sense.
And so it would be nice to just keep that in front of us. Because, as we look, especially coming up on new budget, core mission is just so central for what we do. And keeping our eyes on core mission doesn't get too far away from connection enrollment. I mean, it really doesn't. So it's one of those things that I think if we can make sure as we get into budget that we really understand what that looks like, it gives us a better story on the budget in terms of what we might be able to do relative to potential. So.
Yeah. One thing that really gets to me is that the number of persons that I talk to on a regular basis that have not even attempted to apply for the.
Yeah, right. Yeah.
But need healthcare.
Sure.
So, that's what we big about church.
Yeah. Yeah, I think that's the case, Reverend, with everybody you talk to. And I will talk to people. And are you aware of the JPS Connection Program? No. So we'll make a phone call because that program is there. And, it's not that I'm saying we need to advertise it. It's just that when there's a need and a core mission, being able to meet those two together is part of what we're here for. So that'll give Roy something to think about when he gets back.
Sure. He's a project when he gets back.
All right. Any other questions for Courtney on the financial metrics?
I have another question on the patient cash collection.
Oh, yes.
Since we don't know what the ATB look like, so what is our AR days look like? What is breakdown, like cash collection, like because we don't know what, it's kind of hard to tell what is collecting from copay deductible, or are we collecting enough for out of network type thing, or any other complication that we may have with the collection, because every dollar count. Right?
Our AR days is 39.
Mhm.
And that's been pretty consistent,
Mhm.
each month. On the patient cash collections chart there, you do see the two bars in December and January, you see those kind of pop up
Mhm.
over the budget. Whereas November was under the green line, right there is the budget. And that's due to timing of, Africa payments. So the funding for Africa and the rate changed in December, and it took a little bit for payers to get that updated in their systems and to get us paid. So, but we do track cash collections against our net patient service revenue,
Mhm.
and we are on track where we
Mhm.
need to be.
Yeah, because do you guys internally measure, because a lot of it is outsourced, so we may have one and then we may have a secondary and all that stuff.
Mm-hmm.
Is it, I just want to see, is it worth those contracts, right? Because, and then are we keeping track? Because you can go from one and then roll to the next one.
Mm-hmm.
And the next one, are both of them billing us when the money coming back?
Yeah.
And by the time we pay all the fee, the first one, if we didn't take out the first one, because the second one is the one actually bear the result. Are we paying for both? And then what is their net after that for us, really? Because I've seen so many contracts that we have out there, but we just don't know the performance of it.
Well, that sounds like another good project for
Mhm.
Rory. and his team.
We've actually done that, DT. It's been several years, but we actually went back and looked at each one of the AR contracts relative to collection percentages to look at what that rollover was and how many of those on the aging report were moving into the following contract.
Mhm.
So it's probably time to refresh
Yeah.
that, Courtney, and
Yeah.
just take a look at it and see. Because ultimately, the aging report's going to give us the big picture, but what it doesn't necessarily do is tell us whether or not we have the most efficient contract style relative to those collection obligations. So yeah, it's probably time to bring that back.
Let's run out clauses and then mix that with Medicaid eligibility.
Mhm.
And then it's maybe 6 months, 9 months down the road, or a year and a half if it's Social Security.
Yeah.
And then all that collection, do we go back and pay another fee on top of it?
Yeah. No, that's a good question.
Okay.
All right, other questions for Courtney? Right, Courtney?
Yep. One more slide here, financial goals. These are just additional financial goals that we track and report out to you each month. The one thing I'll point out here is the Medicare retention goal, which is to retain JPS Connections patients that are transitioning to Medicare. Work continues around that. We're doing very well at 46%, which is above the stretch goal.
Performing great, left without being seen is 1.6%. That's incredible on ED. Length of stay, we're still under six. Yeah, and it increased again last month. I see. I mean, every time I think we've hit capacity, we somehow get more people through there. So,
I can remember days that was way up.
boy, me too. Me too. And 54,000. So we're doing well on our, doing well on connection too. So good report. Courtney, anything else you need to talk to us about today?
I do. So do I need to ask for an approval of the January
Does that
2025?
complete the financial
It
report?
does, yes.
Alrighty, perfect. So we need a motion on Courtney's report. Reverend Emerson, Dr. Davis, DT. Okay, second by DT. Any questions or discussion? All in favor say aye. All opposed, same sign. That motion carries. Alrighty, Courtney. You're gonna take over the policies and plans on item B, is that right?
Oh, yes.
Or is that you or is that somebody else?
No, she's gonna do the policy. That's what policy.
Oh, is there?
Okay, it's not on there. Just present the.
Okay. Yes, in your portal, you should have, the investment policy for approval. It is LDF 4900. This policy is largely governed by the, Public Funds Investment Act, or PFIA. It was reviewed extensively internally and through a legal perspective to ensure that it meets the requirements. There were a few just, bullet points, that we updated, based on just very, very small tweaks to some of the contract language, like 4 or 5 different areas. If you all had a chance to review that policy, I'll take any questions that you have, and if not, ask for approval.
Really nothing material here. It
No.
looks like it was just simple word changes.
Yes.
Any questions for Courtney on the investment policy? If not, we need a motion to approve that. Dr. Davis, second. Reverend Emerson, any question or discussion? All in favor, say aye.
Aye.
All opposed, same sign. The motion carries. Thank you, ma'am. And is that it? Do you have other policies or is that the only one?
That's the only policy.
Awesome.
I have one update before she moves into contracts.
Okay. Go ahead.
Okay, so is this on the screen too? In your book, you would have noticed that there is a new format for executive summaries that you will see in your portal going forward. Really, that's just to kind of streamline and have some standardization around how we're presenting. You'll also see space on that document for key performance indicators. That's on page 57 of your book. So just wanted to point out that you'll see that going forward, starting next month. That part will be in the portal. And then you'll see up on the screen here, we will now have a slide deck for the actual presentations of the contracts during the meeting.
Good. That's a good improvement. Thank you.
Can I just make a comment on the form? On this form, could you add something? If sometimes when you go out for bid, I would like to know if this is a continuation, if they received it again. And if they received it again, did they actually meet their matrix?
Okay.
Dorothy, we do have that conversation internally, but we'll be glad to add that as to whether they're an incumbent and were they a good incumbents, but we will be glad to add that.
Is it just a blank in a box that you put in there, Daphne, or what?
Yeah, so we already have, whether or not it was awarded through RFP or if it was exempt, so we can just make sure that that's a bullet point that we talk about. Thank you.
And do we have to take action on that or not?
No,
a
that's just
report.
information on.
Okay, great. All righty, so Courtney, we are on item D, correct? Consider approval of professional services agreement between Elevate and Hospital District.
Yes.
It's item D.
This contract, this contract kind of goes in conjunction with the next contract as well. Elevate Patient Financial Solutions and the next one, which is Resource Corporation of America. We use both of these vendors to provide Medicaid and Social Security disability eligibility and enrollment services. We like to use two vendors for this. They split the alphabet. Both of these vendors are the incumbents. These contracts were awarded through the RFP process. And for Elevate, the annual spend is $1,481,000, and that was included in the approved 25 operational budget. And total spend over the 5-year term would be $7,408,000. That's a different contract that's coming up. Oh, no, these two are the incumbents, so I'm not sure. These are not replacing, so I'm not sure about the Change Healthcare contract.
This is a renewal, isn't it?
Mhm. It is.
My question on these contracts is, I think it ties into what we talked about earlier, is that we are paying out $1.4 million a year, 7.8. Do we verify that they pay for themselves, or are we paying money and never recapture that? So to me, that's important. We're paying out this kind of money. Do they collect enough that we can verify that they? Yes, sir.
Right.
Yep.
And with these two vendors, they are contingent fee contracts, so we pay them based on what they collect.
I'm not sure if you do contingency, that they might get contingency, but if they never meet what they should have, then you would not meet your.
But they're actually, Dorothy, if I'm not mistaken, those contracts, they don't get paid unless
Unless
they
they-
bring it.
yeah.
It's literally eat what you kill
Mhm.
contracts. They could be paid nothing
That's
if they
right.
don't collect accordingly, right?
Correct.
Okay.
Many years ago. The other two contracts, I'm not sure if they do the same thing or not,
Mhm.
but from my deception, when they are in the hospital, they usually send Jake destination. They said, they have to be money in it. But if you do that, if you did that, then the enrollment for next is going to go up. But then when these people, they still in town, they have a more tendency to give you the money, but just that time, because they don't know the other those things. They do want to be appointed there for me and all that stuff. But if they go home, the phone call that company collection phone call, they would never return the phone call.
Mhm.
So if they somehow down the road, they got qualification for that, will be spent on the next to reconcile that and take it back. And then he would come back and become paying them for that. And then I think it also narrow the scope that are on the state.
This was $7,000 high, then open up for any fee. This I think this this the cost of the office going to be the serve or something that mom they will put mom on the same business.
So I think DT, what we probably need to do is just have Rory prepare an agenda item to show us the flow chart and the process relative to those recollection efforts that you're talking about. We clearly don't have any of that today, but
Many years, no place, so. that's why
Yeah,
we didn't come up with it.
yeah, no, and every time one of these contracts comes up,
Yeah.
this discussion ensues.
So DT, are you questioning why we're doing this work? I guess I'm not sure how we need to look at this.
Yeah, we have to look at the total though, because sometimes we get a really good fee from them, but then they cut having people on the side. If you use the cost, but they check big dollar packet.
Oh, I see what you're saying. Are they
It's
truly
really-
reaching?
it's
Okay,
contract Execution.
no.
It is.
Are they gaming the system somehow? Okay,
But then my loan would be, they're gonna take a advantage on the other side to go for the check.
And to some extent, that's contract scope construction.
yeah,
I mean, that's making sure that we've written the scope to avoid
exactly.
those. But I think that's where we just have Rory come back and give us a presentation on that whole process. Because I think there's,
I do understand that they don't get paid, but I'm not sure that when you look at the process, when they are paid. We looked at it one other time.
we did.
Because they have a contract that says 1.4, they are paying their employees, so
Yep.
you are paying something. And so that contingency, when they get paid, do they ever make that's
Yeah. No, it's time to bring it back up. It's been a while since we've addressed it and it's,
And I think that when you bring forth a renewal of this, that will be part of that
mhm.
new stuff that she added to that form, because it just makes sense.
Yeah.
That if you said you're gonna pay out this much, if you pay out this much, and we collect.
Yeah.
And I understand they're both contingencies and I get the idea of having dual vendors here, but is the second one $400,000 better than the first one? I mean, why would we not just double the scope of the first one and save $400,000 to $800,000?
Yeah, and they have a little different fee schedule, but also the estimated cost of the contracts are, based on historical spend.
But
And
it's
so,
contingency, right? So that means we're collecting above that. So why would we not choose to use the solo vendor that we would have better
Yeah.
returns with?
Remember, we're dividing the alphabet, doesn't mean the number is the same.
Yes.
Remember, it's all alphabet driven.
Yeah, I get that, but I mean, so it could just be a math problem of how we divide the alphabet, but it's on a contingency and it would appear there's different rates.
One of them
there.
is much more efficient.
Yeah, I mean,
I mean,
I think we're reading a little bit
I
too
think,
much into this. I think
This-
it's,
I mean, list of things.
yeah, no, I mean,
I think everybody understands the question. I think the resolution here is let's make sure we come back with an agenda item that addresses the scope of those contracts, the circumstances where one contract would be applied as opposed to a different one. It's not just the alphabet. I know a lot of it has to do actually with what collection aging says on some of those reports. So there's a lot of different elements to that scope that we just need to bring back.
Yep.
And discuss it, and it'll just give Roy something to do when he comes back.
he's gonna be awfully busy.
That doesn't depend more on this one. On this contract, you always have two, one team from this vendor may call, but they have no answer for 30 days or 45 days. We want to go to the second vendor, see if they can have a better way of getting than the other one. So you backfill the contention doesn't really represent the actual dollars have to be paid them, so just have that. But it's one, it's a two, so then it's like, otherwise.
Well, and there's quality metrics associated with this too, because we had this issue about, and you will remember it because you were here with me. We had some pretty draconian collection calls. We had some pretty aggressive collection efforts. And while the overall goal was, sure, let's make sure our contract's efficient, we had a lot of complaints because there was some extremely zealous collection calls. And that's part of what we're making certain that we're doing. It's not, the goal is not just to go collect it. It is to make sure we do it with the coordination and integrity of the hospital. Because that was a long, detailed discussion. I remember that very, very well. Okay, we need to get a motion on both of these, correct?
Yes.
Let's take them separately, I presume.
Okay.
All right, so let's take our, the first one first, which is the,
Elevate.
Elevate. Need a motion on the Elevate contract. And the assumption here with this motion is that we are going to come back and revisit. We're not just going to forget it, but we do need to move these on in the process. Okay, motion from Ralph. Dr. Fowler, any questions or discussion? All in favor, say aye.
Aye.
That motion passes, and then we'll go to the next one, which is Resource Corporation, County Hospital District Resource Corporation. Have a motion on that one? All right, Ralph. Second from Dr. Fowler. Any question or discussion? Not all approve, say aye.
Aye.
All righty, that motion carries, and that takes us to, and by the way, Ashley, thank you for working diligently on the agenda. We're making progress because the goal here is to be able to look at that agenda and then be able to click on a Roman numeral and go straight to that without having to page through it, because old people like me have a hard time finding it the second time. But Ashley's doing an awesome job in figuring that out for us. So that'll take us to item E. Is that right? No, item
Yeah.
F now. Consider approval of client services between MultiPlan and the hospital district. Courtney?
Okay. So this one is for a vendor that provides clinical claims editing services to ensure claims payment accuracy for our medical services reimbursements. This claim service, editing service will allow us to save cost because it looks for things like double billing, upcoding, coding errors, and flags those for review. This service was actually contracted previously with Change Healthcare in the hospital district. And it was in the implementation stage, and after the cyber attacks, they were unable to fulfill the obligation for that service. So we had to go out and find a new vendor. So MultiPlan, the MultiPlan contract of $363,000 annually is not included in the 25 operational budget because at the time we did not have a vendor identified. However, it can be absorbed within the current budget, and this will save us money over the life of the contract by not paying claims with erroneous billings.
And we had a vendor already that just wasn't cutting the mustard or couldn't do the work or what?
It was a very old, outdated, and sunset system.
I see.
I'm not aware of that contract. What was the name?
That's a frightening level of detailed recall that actually stuns me. I don't remember that. Yeah.
I know we had a contract that we had where they were looking at, it, but we always had, I don't know the name.
Is he called while they were like, we had, I think, go back,
No?
back to leadership, he's not supposed to all that.
Okay. All right, more homework for Lori. All right, questions for Michelle on this one, and this was not budgeted, but you say it can be absorbed within the existing.
It is, and the estimated cost savings over the life of the contract will cover the cost as well.
And what's the term on this one, Courtney?
5 years.
5 years.
Mhm. This is on the hospital side for our medical services reimbursements that's where we pay external providers and a claim physician group for connections patients.
Did you have more than one respondent to your RFP on this?
This was the only one.
One. Okay.
Mhm.
All right. Recommendation from staff is that we approve this contract with MultiPlan. Do we have a motion? Moved from Reverend Emerson. Need a second? Not all at once. Anybody want to second this?
Second.
All right. Justin is our second. Let the record reflect. Any questions or discussion? All in favor, say aye. All opposed, same sign. Okay. Let the record reflect that DT abstained from the contract between Tarrant Regional and Tarrant Hospital District and MultiPlan Incorporated. Okay. Courtney, you did a great job.
Thank you.
We're just happy to have you here and just tell Rory, so no questions, everything was smooth and easy, and here's your homework assignment.
Exactly.
Hi, Zelia.
Hey there.
We are looking at the contract between Tarrant County Hospital District and MHMR. The wonderful, every year we talk about MHMR contract.
Yes. So, good morning. I'm here to, ask for your approval for, consideration of the professional services agreement between MHMR of Tarrant County and the Tarrant County Hospital District. This is a, revenue contract of $1.6 million, which, has been included in the approved FY25 operational budget. This provides inpatient mental services for patients who were involuntary committed through a collaboration with MHMR of Tarrant County. And it does align with the district's strategic plan to improve patient outcomes for adults with mental health issues, as well as improve access to services for the communities we serve. And it does carry a 60-day out clause.
Zelia, are any of these patients being transported from the jail, from correctional services?
No, sir.
Okay.
These are
completely separate.
oftentimes they're just brought in by the police and the community under a detention warrant app. And if they do not have any insurance, these dollars help reimburse that. But it
Okay.
does not cover all of the cost of what we spend.
Mhm.
So I want to make sure that everyone understands that as well.
Does MHMR, I mean, obviously MHMR is receiving federal funds for the proportionate share that we get back. Is there any way to approach them to say, hey, we're not covering cost here?
Actually, they get these funds, they're state funds from HHSC.
Okay.
And HHSC, distributes them to different community mental health centers across the state. And those community health centers can do with those dollars what they choose to do in the community. MHMR chooses to give those dollars to JPS to help offset some of the indigent cost.
Do you have any idea what kind of percentage we cover with this?
Small percentage.
Small percentage.
Yes.
We're still spending a whole lot more.
We're spending
We're
a whole lot more.
a whole
But
lot more.
You ask a great question. I don't know if Ashley Quinones is here. She's not. But really, to your point, could we have stronger advocacy or, some sort of education to the state as to how much of a gap there still is in covering those services? Because we know those services continue to increase as the population increases. And so we have asked Ashley to look into this. Yeah.
Well, now's the time because
Yes.
there's a lot of bills being filed right now.
And behavioral health is probably the only, besides maternal health, that's getting any attention. Yeah.
Yeah, so it's a good time to follow up with it.
But do we get any outcome report back from MHMR?
I'm not sure what you mean by that.
We treat the patients.
We
They bring
treat
to
them.
us.
To us, it would be our outcome.
All we get from them is the
The,
patient
the money.
and then a portion, a tiny bit of the money that it costs to treat the patient, right?
Yes. We provide the treatment. And so we have our own internal quality outcome metrics for our patients.
Does MHMR have any influence on the dollars that they receive relative to what we collect at the state level?
I'm not sure how much influence they have.
I hope they're advocating,
Yeah.
on our
That's what
behalf.
we're working on to see.
Yes.
Have they been through the new PEC? Have you taken the MHMR staff? to-
Not yet.
Okay. I bet they will be thrilled to see that.
We'll be excited to, because they will, have an embedded MHMR specialist in the PEC 24/7 once
Great.
the new PEC opens.
Awesome. All right, you've heard Zelia's recommendation for the MHMR contract. Any questions for her? If not, we need a motion. Have a motion from, is that Dr. Davis or Dr. Powell? Dr. Davis, and a second from Reverend Emerson. Any question or discussion? All in favor, say aye. All opposed, same sign. Yes, sir.
I just want to say, if anybody outside of Dr. Duncan represents JPS, she does.
Oh, man.
She did almost there, community conversation. I did this Western the other day.
Oh.
Outstanding job representing this hospital.
I didn't know you were there.
Yeah.
Well, thank you, Rev.
Yeah.
It's an honor to be able to work within an organization where our board supports all of the behavioral health services that we do in order for me to speak about that and represent JPS and for Dr. Duncan to be so supportive.
Yeah, congratulations, Zelia. We're very fortunate to have you, and you always represent JPS in the highest possible way, and we do appreciate it.
Thank you very much.
Yes, thank you.
All right, we are now on agreement between Hospital District and Abbott Laboratories, and that is, who's presenting this one?
Good morning.
Good morning.
Charlie Cobb, VP of Supply Chain. I'm here to present the contract for your consideration for Abbott Laboratories. This is for coronary products and accessories. It is a result of an RFP. $397,000 a year estimated spend, 1.9 million over the 5 years. Is primarily drug-eluting stents. This is one of 3 vendors that was multi-awarded in this category. The prior 2 were presented last month. This represents an estimated annual savings around $167,000 for this category. It is physician preference. Happy to answer any questions.
Savings is a result of the cost, same cost for the same equipment last year, or where's the savings come from?
Yeah, multi-bid. There was another vendor that did not bid, so we're able to consolidate some market share and also drive some better pricing through the result of the RFP.
Great. This is doctor preferred equipment?
Physician preference, correct.
Perfect. Good. Any question or discussion? Charlie, thank you very much. We need a motion to consider approval of this Abbott Laboratories. A motion from Dr. Davis, second from Dr. Fowler. Any question or discussion? All in favor say aye.
Aye.
All opposed, same sign. That motion carries.
Thank you.
Thank you, Charlie. And Joy, consider approval of a maintenance agreement between Brandt Companies and the Hospital District.
That's right.
Hi, Joy.
Hello. Yes, I am bringing forward for your consideration approval of a maintenance agreement between the district and, oh, this didn't go forward. Hang on. There we go. Oh. Brandt Companies. This cost is included in our capital budget. We did go out for RFP for this award. This provides the professional services for the installation for mechanical and electrical upgrades that are necessary in our main inpatient pharmacy area. And so I'm seeking your approval for this contract.
So Brandt is a supplier of the equipment.
They're doing the labor, the supplies, and the installation, so all of the above.
So labor supplies are both included in capital budget.
That's correct. This is the full package of this construction project.
Any questions for Joy? This is all budgeted and went through an RFP process?
Yes, it did.
Okay, need a motion? Motion from DT, second from Reverend Emerson. Any question or discussion? All in favor say aye.
Aye.
All opposed, same sign. Thank you, Joy. You have another one or you're still?
I have a few for you today, yes.
Renewable Commitment agreement with.
I'm trying to get
Nova
Charlie to get up here and do all mine for me since he's new. Okay, this next one is requesting your approval for a consumable commitment agreement between the district and the Nova Biomedical. This is included in our operational budget and is an acquisition through our GPO, so through Vizient. But this provides all of our glucose, the glucometers, the strips, and the reagents. And of course, we commit to a spend with them, which of course we look at from what we do from an annualized approach, and this is within that.
Okay, heard the report from Joy. Any questions? If not, we need a motion. Motion from Dr. Fowler, second from Dr. Davis. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. Thank you, Joy. Now we are at medical physics.
Yes, this next contract is for a professional service agreement between the district and then Partners in Medical Physics. This contract, again, awarded through RFP process, provides physicists to help support our radiation safety programs. They provide the calibration for all of our radiology equipment. So the dosage, the regulatory, and then support internally for us. So that's what this service agreement provides for us.
Questions for Joy on this agreement? Not, we need a motion. Motion from Reverend Emerson, second from Dr. Fowler. Any question or discussion? All in favor, say aye.
Aye.
All opposed, same sign. That motion carries. And Siemens Medical, right, Joy?
Yes, this one is this is a purchase agreement between the district and Siemens Medical Solutions. This agreement is allowing us to procure a Siemens Artis Icono biplane. This provides advanced diagnostic capabilities for cardiology and neurology in our interventional suite, so in our IR lab. And so this is replacing another piece of equipment, single plane, that was end of life. And so we're excited actually to have this additional biplane in service.
And this was an exemption on the RFP.
It was acquisition through GPO.
All right. Any questions for Joy on the Siemens contract? If not, we need a motion. All right, motion from Dr. Davis, second from Dr. Fowler. Any question or discussion? All in favor, say aye. That motion carries. And Joy, we're at Superscapes Opco.
That's right. We're going outdoors. This is the professional services agreement between the district and Superscapes. This was, again, awarded through RFP process, but this professional services agreement provides all of the maintenance and support for repairs, equipment for landscaping for all of our locations through the year.
Is this a new vendor?
This is actually incumbent, and we did go out, like I said, for RFP for these services.
Okay. Happy with their services?
We are.
Good. Any questions? Need a motion?
Get more than one bidder on this.
Yes, we did. We had 3 bids.
Were they the low bid?
They were the lowest bid. This vendor actually supports from a reference standpoint, the Cowboys, stadium, a lot of different entities, hospital districts, children's out in Dallas. So we definitely did our homework when we were investigating all of the different vendors that.
This has been the best vendor since I've been here, and the offsites especially. I mean,
Yeah.
the first time when I'm rounding, I really felt like
Yeah.
there's
And they,
attention given to the landscape of the clinic. So
And they have the clinics and the campus, right?
all. And we've made this more robust, and then the expectations from a KPI, they joke with me, but I really take the beautification of the campus because we have a lot of pride here. So definitely a lot of.
Joy's had them pull up things in the past, like this is not
Right.
going to work. And they're like, okay.
See a
But
picture of
very-
that flower? I don't want that flower back in there.
I know when I visited South Campus recently to round out there, and I was like, wow, I have never seen the resource center, South Campus area, like with grass. I mean, it was just like that. So, yeah.
Grounds do look good. They look very good.
Yes, we have a lot of pride with JPS, and we're proud every morning that we walk in and we want our patients and our visitors and our staff to feel that too. So yeah, we're on top of that.
Good job, Joy. Any questions for Joy? We need a motion. Motion from Reverend Emerson, second from DT. Any question or discussion? All in favor, say aye. All opposed, same sign. That motion carries. And Joy, now we are at Varian Medical Systems contract.
That's correct. So this, I'm requesting 2 things: exemption to bid and then addendum to our agreement with Varian Medical Systems. This allows us to purchase an additional linear accelerator for our oncology infusion suite. And the request for exemption to bid is because it allows us for this second linear accelerator to match our other linear accelerators. So synergies for the staff, the providers, again, the physicists who come in. So there's alignment. And then of course, Dr. Dahia, Dr. Gabosh are physicians who look to what product is best for our cancer care services, chose this linear accelerator. So the current linear accelerator that we are replacing is end of life. And so our team is extremely excited to be able to provide this service, to provide radiation oncology services to our patients.
This is the same vendor that provides the existing accelerator?
That's correct.
So it's same service agreement.
Perfect. Any questions for Joy?
What is? Yes, maintenance, there's the warranty, and then the software is also included. Yes.
All righty. We need a motion. Motion from Dr. Davis, second from Dr. Fowler. Any questions or discussion? All in favor, say aye.
Aye.
All opposed, same sign. That motion carries. Thank you, Joy. Does that do it for you?
That's it for me.
Good to see you today.
Yep.
All righty. Ms. Ridgeway, Washington, we're good. This is additional spend for program agreement between Incentive Services and the hospital district. Good morning.
Good morning, how are you?
It's still morning. Yes, it is.
It is still morning. So I'm here before you today seeking approval for additional spend for our incentive services contract. This contract could have an estimated cost of $750,000 per year with over a 3-year period. And so this contract is for our incentive services, our rewards and recognition platform that we leverage to reward and recognize employees for a myriad of different things, from real-time recognition to thinking through patient experience. We also use it for things like quality. We use it for our service awards and many other strategic initiatives. It has both a point and a non-point component, and we are here requesting the ability for additional spend against that contract.
All righty. Questions relative to the Incentive Services program?
Sure. So really the ability is up to, the way the incentive services platform works is that you don't actually pay for, so it's a point, there are points associated with it, and you don't actually pay for it until the employee redeems it. And so the estimate here, which, our contract team led us through, really contemplates that we may not spend that much, but we need that ability to be able to spend up to that. Right now, our 3-year utilization in terms of redemption is about at 53%.
Ergo, keeping the total spend at much less than what the 3-year multiple would be at 750.
Correct.
Any questions? Need a motion, please. Motion from DT. Second from Reverend Emerson. Any question or discussion? All in favor, say aye.
Aye.
All opposed, same sign. Thank you, ma'am. Good to see you today.
Thank you. Have a great day.
William. William has a lot of them coming. William, good to see you, sir.
Good morning. Nice to see you as well, sir.
Talk to us about the Vizient contract.
Now, I'm bringing forward a request for purchase for WOWs. That's a noun, not a verb. Those are workstations on wheels. I've got an asset pool of 342 of them. I've got 32 that are non-serviceable since October. I've got 25 in a state of disrepair. I've got a request for 8. That leaves me with 35 to do general refresh, so I'm asking for a purchase of 100.
My goodness, that's a lot that don't work or in a state of disrepair.
They're used heavily.
Wow. So they just go to the bullpen when they break down and you wait for next year's budget?
Yeah, I was going to say, what's the delta?
I'm sorry.
What's the delta of what needs to be replaced versus what we're replacing?
Well, I want to get to the point where I've got at least a 25% turnover on a regular basis to be able to keep up with it. But I've got about 60 of them that have to be addressed right now.
Yeah.
Okay. Just want to make sure that we're covering what you need.
Because you're not in a circumstance, this is a question. Are you in a circumstance where because of the number of units that are down, it's affecting patient
Oh,
services?
definitely. Definitely.
So
No.
then doing this annually would seem like the contract should allow us to be able to go replace and repair as needed, not once a year.
Yeah.
We have just started into the process of doing a generalized refresh on a regular basis and gotten in that planning. Last year, we did 20 of them. We started into the throes. This year, we're doing 100 to try and get into a cadence so that we can maintain a general refresh cycle.
Okay. Yeah, because that's the goal, right? I
Yeah,
mean, there
yes, sir.
should be a refresh cycle that doesn't put
Exactly.
you in a bind at the end of the year with that many units
Exactly.
down.
That's the goal.
Totally. I
Great.
totally agree. So, yeah, it's not affecting patient care. These are workstations, right?
Yeah.
For Epic. Okay, I just want to make sure.
Sure, I
the
understand.
quality.
I understand. But when you got 3 people that can't use a workstation, I mean, at the end of the day.
Totally agree. And we've had some internal conversation as exactly what you are referring to. How might we be able to budget in such a way that we can replace these in real time?
Just because 20 questions is always fun with you, Will. How many workstations do we have at Jacobs?
342.
342.
The
That's
asset pool.
on wheels.
On
The
wheels.
campus, are these also at the clinics or on?
Yes, sir. That's throughout the organization.
System.
Yeah.
And those are just the one on wheels, they're not the ones that are actually already.
No, I understand. These are just the ones we can push around.
Yeah.
Fantastic. All right, you've heard William's recommendation considering the addendum to the Vizient contract to make sure our workstations on wheels are up and running. Need a motion? Motion from Dr. Davis. Question, a second from Reverend Emerson. Any question or discussion? All in favor, say aye.
Aye.
All opposed, same sign. That motion carries. And Will, now we are on GE Medical Systems, right?
All right, so GE is an existing contract. It's the product that we're using is the Airstrip, which provides integration with waveforms into Epic, mostly utilized in procedural patient monitoring areas. As this is a true up, we've exceeded our utilization rates and we just have to true up with the vendor.
All righty. Any questions for William on the GE Medical Systems recommendation? If not, we need a motion. Motion from Dr. Fowler, second from Dr. Davis. Any questions or discussion? All in favor, say aye.
Aye.
All opposed, same sign. That motion carries. And Will, you're still on board now with GTS Technology Solutions.
All right, so GTS is the value add reseller for our Palo Altos. Palo Altos is our firewalls for the organizations. This is a licensing for the existing equipment, and the 18K is to bring up the all of the equipment up to standards from a software perspective.
This is the budgeted spend, correct?
Yes, sir.
3-year term. Any questions for William? Not, we need a motion. Motion from Reverend Emerson. Second from DT. Any question or discussion? All in favor, say aye.
Aye.
All opposed, same sign. That motion carries. Thank you, sir. And finally, the exemption to bid on the global terms and conditions between QTS Investment Properties.
Yes, sir. QTS is our co-location data center up in Alliance. If you remember, we had one in Richardson. We closed that down. We still have one in Alliance. We're looking to extend the contract until we move everything to the cloud. The request for exemption is, quite frankly, there may be some folks that could do it cheaper, but getting out of Richardson took us a year and was almost $700,000. So to be quite honest with you, it seems prudent just to stay with the existing vendor till we can close down the contract completely.
Does this represent 100% of our backup cloud capacity at this location? Or are we still split?
We're still split between here on campus and the Alliance data center.
Is that a design split or is your goal to get them in one place?
My goal is to get everything into the cloud and have multiple locations.
Yeah, okay. All right, good. Any questions for Will? Then we need a motion. Sir.
What's that? Yeah, they're magnanimous with us.
That was very magnanimous. Very magnanimous. That was the price of admission to Will's office if you didn't have that discount in there. I have a motion from Reverend Emerson, second from Dr. Davis. Any question or discussion? All in favor, say aye. All opposed, same sign. Will, it's always a pleasure, sir.
Thank you, sir.
Thanks for being here. We appreciate it. Okay, do we have any executive session items? Wow. 11:20 and we have completed our agenda. Anything else for the board? Thank you for being here today. We will adjourn at 11:18 and look forward to seeing you next time. Thanks for being here, everybody. Yes, sir.
You got that mic. You got that mic with that call.
Because nobody can hear DT anyway, but you don't have one.